So tell us, what do we mean by trauma?
Well, trauma comes from the Greek word called wound, a wound. And it can be physical or emotional.
Yeah.
In fact, you can have a physical trauma that eventually leads to emotional trauma.
Yeah.
Trauma and injury are interchangeable.
Okay.
Because the injury can be both physical or mental. It is still trauma.
Okay.
Yes.
So what are the main causes of trauma in sub-Saharan Africa?
Well, interestingly, those people you interviewed got some of it right.
Yeah.
The main causes in our region, sub-Saharan Africa, is road traffic accidents. Aside from that, you have the second main cause would be what I call human-to-human violence, human-to-human interactions.
Yes.
This could be crime. And then the last two major groups are what I call occupational injuries, occupational trauma, and also domestic trauma that occurs within the house.
Okay, so why is trauma important? Why is that important for us here in sub-Saharan Africa? I know you said the major thing is motor vehicle accident, but what is the big deal about trauma here in Africa?
Well, in our region, in sub-Saharan Africa, we already have a big health burden trying to cope with communicable diseases like malaria, TB, HIV.
Yes.
And also the non-communicable diseases are increasing in frequency.
Yes.
More and more people are getting diabetes, high blood pressure, cancer. We already have a big burden.
Yes.
And with the growing industrialization that we're going through, more motorcycles, more vehicles on the road, more people get into economic power where they can actually purchase these vehicles. Even in the agricultural sector where they're getting more mechanized.
Yes,
The importance of trauma, that we have to take it seriously, both as individuals and as government, it becomes more significant in our region in particular.
Okay. So you mentioned all these different kinds of trauma, the occupational, the motor vehicle accidents. Yes. So who's at risk for trauma?
Well, let's look at the 4 different causes of trauma, and then we can identify the people at risk. First, we talked of road traffic accidents, where really anybody in traffic will be at risk for road traffic accident. Now, if we come to human and human violence, which was the second cause that I outlined, the people at risk could be any of us, all of us.
Yes.
Anybody could be a victim of crime, a victim of terrorism, a victim of any kind of communal violence.
Yes.
And the third cause of trauma, when I said occupational injury, well, it depends on your occupation. Like you know, recently there has been some explosion in some factories in the Far East, in China. So again, the occupational hazards depend on the kind of occupation that the person has. Okay. And as far as the fourth cause, that is domestic trauma, well, the people that are most at risk of domestic trauma are children, young children, and elderly people. Okay. But technically speaking, there are wires, there's water, there's electricity, there's sort of gas within the house. We're all at risk for domestic injury.
So why is Africa, why do we have the highest number of road traffic fatalities in the world?
That's a good question. We look at it from 3 different factors that contribute to this high fatality rate. Driver factors, okay? Environmental factors, okay, and vehicle factors. If we look at the driver factor, is the driver capable, health-wise, physically capable to handle the vehicle? Drunk driving, the use of seat belts, things like that, obeying traffic rules and traffic regulations. Do they have good vision? Things like that are driver factors. These things are undermanaged in our part of the world and contribute to the high fatality. Then we look at vehicle factors, and environmental factors, basically maintenance. Do you maintain your vehicle, whether it's a motor car, a bicycle, or a motorcycle? There has to be some regular maintenance to make your car roadworthy. Yes. And also, as far as the environment, well, this mainly depends on the government. Roads have to be maintained, roads have to be kept in proper, roads have to be well lit, and things like that. So that's how we look at it: driver factors, environmental factors, and vehicle factors.
Okay, so let's talk about driver factors.
Yes, drunk driving, it's a major problem all over the world. The difference between us in sub-Saharan Africa and the rest of the world is that they're doing something about it, and we are not. Yes. The blood alcohol limit that you can have is a figure, let me just throw a figure, 0.08 milligrams per 100 mils of blood. That's just the limit in the United States, as far as I know. Yes. Now, It's the same human being, same human body. That same limit still applies to us human beings in Nigeria.
Yes.
And most people don't know how they can get to that limit. For instance, if you just took a glass of wine, just 150 ml of a glass of wine, just about the content of just over half of a bottle of a soft drink as wine, that's already one drink. If you took a shot of whiskey, gin, or even ogogoro, or the local concoction, just one shot is considered that one drink. And then a bottle of beer, just half a bottle of beer, let's consider that one drink.
Half a bottle of beer.
Half a bottle of beer. Now, that alcohol limit I told you, 0.08, to get to that limit, don't forget it's a limit, legal limit, you cannot reach that. To get to that limit, an average size lady will only need to take 2 drinks.
So either 2 glasses of wine,
2 glasses of wine,
1 full bottle of beer, or 2 shots.
Or 2 shots.
And right away, you're already at the limit.
You're already at the limit.
Okay.
And the man, because they metabolize alcohol slightly differently, would need 4 drinks, just 4 drinks.
Okay. So 2 bottles of beer.
Yes.
4 glasses of wine.
Yes.
Or 4 shots.
Or 4 shots.
And you're at the limit.
And you're at the limit. But here's the deal. The problems arise way before you get to the limit.
Yes.
Even when you're half at the limit, you're still legal.
Yes. But you're already affected.
You're already affected. You're already impaired.
Yes.
Your judgment is impaired. Your vision is impaired. You can't multitask. That's even the wrong time to even pick up a cell phone and say you're making a call and you're driving, because you cannot do 2 things at the same time. And the risk increased significantly. The best limit is 0.
So, as you said, the best amount of alcohol, the least amount of alcohol to take when you drive is no alcohol.
Is 0.
Don't take
Absolutely.
0 alcohol.
Yes.
If you know you're going to be drinking, don't drive.
Do not drive.
End of story.
End of story. Do not drive.
Okay. That is really good. If you know you're going to be driving, do not drink. If you know you're going to be drinking, do not drive. Okay. Excellent. Excellent. So there were some of the other driver, factors that we talked about, and I just want to touch on those briefly, like the vision.
Yes.
Okay. What is your recommendation?
Well, in other parts of the world where I have lived and worked, it's mandatory at a certain age that you must get a visual test.
Yes.
Before that, if you have certain diseases that you put on your form, if you have diabetes, if you say you have high blood pressure, if you say you suffer from epilepsy, convulsions, they will make sure you get a visual test before you get a driver's license.
Yes.
And after you've got your license, there must be a period, maybe 2 years, maybe 3 years, that you must continue to submit yourself to visual tests.
Okay.
These rules have to be made, created by the government, and they have to be enforced.
Okay. What other things then can we do to prevent this high level of fatalities?
Well, when we want to prevent road traffic accidents, there are 2 ways to look at it: the government side and the individual side. You've mentioned a bit about the individual side. When you're talking about the environment, a lot of it depends on the government.
Yes.
When you drive on our roads at night and there is no light, and there are potholes on the roads have not been maintained, that is just asking for trouble. We see casualties that have been subject to this kind of accidents in our facility. It's a real thing. It's not imaginary. It happens every day.
Okay. What about things like, because that's another problem that we have in sub-Saharan Africa, is the emergency response.
It's non-existent. Here's the deal with that. A lot rests on government. The government has to train what we call first responders. These are the people that get there first. Policemen, firemen, even the ambulance drivers that drive the ambulance there and come in the ambulance, they have to be trained. And also public volunteers. They did a scheme in Ghana whereby they started training basic life support and trauma support to commercial bus drivers who drive a lot of people in their vehicles in case they're a victim or they're part of an accident, so that they will know the basic things to do before the person is brought to the hospital. So those kind of things are very important in this environment.
So on that note, we will take a short break and we'll come back. And when we come back, we will be talking about the things we can do to help with pre-hospital care.
Okay.
Welcome back to the Health Zone. On today's show, we're talking with Dr. Ogunyemi about trauma and other medical emergencies. So we're going to talk, Dr. Ogunyemi, now about various medical emergencies and injuries and what we should do if we're involved in them. So let's start with what we were just talking about, road traffic accidents.
Well, if you happen to witness a road traffic accident, or if somebody happens to be part of the accident, and you want to be helpful, the first thing is to protect yourself. Make sure you are safe. Make sure if you're part of the accident, check yourself that you're okay, you have no particular injuries, you're fit enough to actually render help to other victims of the event. And then you need to look at the accident scene. Try and get a quick look at it. All this has to happen very quickly.
Yes.
But the most important thing is be calm. Don't panic, because some of your decisions might determine life or death for some of the victims.
Yes.
Look at the accident scene. Those that are screaming, help, help, all sorts of things, they're able to breathe. Yeah. So they might be okay to leave them for a few minutes. Go and attend to those that are quiet, making no sound at all. Yes. Call them, try to get their attention. If they're unresponsive, you might have to support them, support their breathing and do some other thing. Call for help, because no matter if it's just one victim or many victims, you cannot really be much help by yourself. Yeah. So call for help. If there are people around, call for help to come to assist you. So what you do is, if there are any open wounds, you need to protect the wound. If the patient if there's any bleeding, anywhere that is bleeding, you need to apply some pressure. We tend to advise that you don't apply pressure with the tip of your finger. If somebody is bleeding from a leg, you don't apply the tip of your finger. Use the palm of your hand to press down. Yeah. Sometimes you might need to tie. Or get
a cloth or something. And
exactly. Get a cloth, put a pressure on it, or tie a tourniquet on something. Be careful about neck injury. If somebody's neck is positioned in an abnormal way, do not try to move them, because that can cause much more serious problem. And if you're going to move a patient, you're going to need assistance. This is one of the reasons the protocol for help. Yeah. We move in a way we call a log roll, like when you roll a log. So if you're going to move anybody, somebody has to be at the top end of the patient, somebody at the leg end of the patient, and in one move, you roll them over. That usually may not be necessary until expert hands get to the scene.
Okay, but a question for you. We know that here in sub-Saharan Africa, expert help sometimes is not available. And what we often find, the typical scenario, is that there's a motor vehicle accident, a whole gaggle of people gather around, those screaming are screaming, oh, you know, praying Jesus, all kinds of things are going on. And then a few people are brave enough to actually go there, and they try and extricate people from the vehicle. And usually it's a good Samaritan, a kind fellow driver in another vehicle or in a taxi that will transport the person to the emergency room. So how do you negotiate that, getting the person, the injured person, from the vehicle or from the road where they've been thrown onto into a vehicle and then transporting them?
Yeah, this is a very real danger. You're quite right, because if in a road traffic accident, the vehicle may still have a fire hazard. Yes. May still be about to explode or catch fire. So unfortunately, we do have to move patients even before expert hands get there. Yes. But here's the deal. This is what the ordinary person should bear in mind. The neck injury is the worst you can damage at the point of movement. Yes. A broken leg is broken. It's not really that much of an issue. Yes. So what they should do, what we can train them to do, is somebody at the top end of the patient has to do what we call inline stabilization. Mm-hmm. Hold the shoulders with the arm grabbing the neck together in a straight line. Okay. And somebody at the other end of the patient pulling back, holding the legs, pulling back, all in one line. Yeah. And any movement or twisting is what like I said earlier, it has to be a log roll. Yes. They must do it coordinated at the same time. Okay. Any pulling must be pulled while the other person is pushing. Mm-hmm. It's all done in line. Okay. This is the best way they can manage, because the patient has to be moved. Yes. And unfortunately, those are hazards. But that's what I'd advise anybody to do in that situation. Okay. You know. The idea is to keep the patient straight. Yes. No flexion or bending of the back, because the bones of the back could break. Yes. No flexion or bending at the neck, because the bones of the neck could break, which is much more catastrophic. Yes. The important thing is, please keep the victim straight at all times of your movement.
All right, one more scenario. Somebody faints. What do you do?
Well, it depends. If you are the person that's fainting, because you might get a premonition that you're fainting, you start feeling faint. Yes. The best is to sit down or lie down. I mean, a faint is really not enough blood is getting to your head. Brain, yes. That is what a faint is. Irrespective of so many causes, it could be you are not eating, your blood sugar is low, it could be because you have a vascular problem, it could be all sorts of things, you know. But what you want to do is sit down, lie down, or put your head between your legs. get to a position where you can encourage blood to get to your head.
Yes.
Part of the thing that may happen when somebody faints, the fainting, the blood not getting to the head may lead to further problems like convulsions and all that.
Yes.
So you really should treat somebody who faints and they're not responding.
Yes.
You treat them like somebody who has had a seizure.
Yes.
Just leave them alone. Check that they're breathing.
Yes.
Check that they have a pulse.
Yes.
Even though they're not responding, but you know it's a faint,
Yes.
you know, just leave them alone. Don't
Yes.
force anything into their mouth. Don't give any food or water. There's some old traditional things they used to do, but don't do it. Just leave the patient. And once they are awakened again, they might need to go to hospital to have a proper check.
Okay. Thank you. Thank you so very much. This has been great. We've learned so much. At least, you know, we don't feel quite so helpless. We know that there is something that we can do in the case of a medical emergency. And so it's been wonderful having you on the show. We hope we'll have you back again to do some other topics for us. And so thank you so very much for being on the show.
Thank you.
This is the Health Zone. We've been talking with Dr. Ogunyemi about trauma and other medical emergencies. I will take a short break right now, but when we come back, I'll recap some of the high points of what he said as to what to do in the case of an emergency. So please stay with us. Don't go away. Okay, that's very, very helpful. So let's talk about heart attack or stroke.
Well, if you happen to witness a heart attack, the person will maybe grab their chest or they may not do anything, they just collapse. Then what we recommend is well, we first call them just to see if there actually is a heart attack or they just fainted. Call the person's name. Hello, so and so. Are you okay? Are you all right? If they respond to you and they're fine, but they're still having chest pain, that's a different thing entirely for you to manage.
Yeah.
Get them to hospital where they get hospital care.
Yes.
But the heart attack we're talking about managing at home or at a restaurant or outside, where the patient has collapsed, you call them, they are unconscious.
Yes.
Okay.
Yes.
Now, you check their breathing. They are not breathing.
Yes.
You put your finger here, you may or may not get a pulse. You
Yes,
typically, if you get a pulse, it will be gone in a few seconds.
Yes.
That is a heart attack in which within 3-4 minutes they will have serious brain damage or they may even die.
Yeah.
So in those kind of situations, you have to resort to what we call CPR.
Yeah.
And what that involves is, are you okay? You're not okay, you're unconscious. Is he breathing? You're not breathing. I've got to help you to breathe. You help them to breathe. But nowadays, we recommend chest compressions.
Yes.
If somebody has had a heart attack and the blood is not circulating, you have to get that blood circulating.
Yes.
The reason I'm saying that, research has now found in the last 5 to 10 years that the compression is actually much more important than the breathing.
Yes.
So you start compression. There's a way you do it. You have to fold your hand, dig the heel of your hand in the middle of the breastplate here, and press down at least 2 inches from the elbow. Bam, bam. It's quite tiring.
Yes.
And if you're working by yourself, you're supposed to do that more than once a second, about 100 times a minute.
Yes, yes.
And what you're supposed to do really is give 30 compressions. And if you're able to breathe for the patient, if you're able to, you clip their nose, you make sure the airway is clear by lifting their jaw up, you clip their nose, and you blow into their mouth twice.
Yes, and then you continue.
Then you go back and you compress again 30
Yes.
times. Anybody can do that without any medical knowledge.
Yes.
That's basic life support.
Okay.
It becomes CPR when you now have to do things like administer what we call an electric shock.
Yes, yes.
I understand there's some what we call AEDs
Yes,
in Nigeria.
in some public places
In some
now.
public places, but I know in other parts of the world they're almost everywhere. Shopping
Yeah.
centers, train stations. If you have an AED, you call for help, get an AED.
And you shock the person.
Stick the leads on the chest. The AED will tell you what
to do. Exactly.
You know, and it will shock the person and give you instructions and all that until hospital help, more professional help gets to the scene. Okay. Those are the basic things. It's just compress the chest. If you can, breathe for the patient. Whether it's one person or 2 people, you still give 30 breaths, 30 compressions. And 2 breaths.
Okay, very good.